There, my name is Sofia Blankenship, and I am a senior health systems management student at the University of North Carolina at Charlotte. I have found a strong passion for the United States health system and the inequalities it has. This has led me to pursue a job in healthcare quality and management in an attempt to better the U.S. healthcare system. I have experiences working one-on-one with insurance companies such as TRICARE and Medicaid, and patients within my internship as a medical office assistant. I hope to enhance my leadership experience to help pursue my passion of working with other professionals and make a difference in our healthcare system. The first artifact I will be discussing is one within knowledge of the healthcare environment. On the left side, you will see Healthcare Policy and Law paper regarding the Affordable Care Act, better known as the ACA. I placed it under knowledge of the healthcare environment as it discusses the current state of the ACA and its future within the United States. After taking this course and specifically writing this paper, I found a strong passion for our current state of healthcare within the U.S., which is what I will be primarily discussing about as a theme within this presentation. After educating myself and truly understanding the foundations of our healthcare system, I found how many holes and areas of improvement we need to make as a country. This paper was one of my personal tipping points where I found how biased and damaging our health system is, and how it really does not favor those who aren't in power, specifically minorities, and narrowing that more down to people of color. Discussing this paper helped me find a strong passion for the obvious biases the country has in regard to our healthcare, and who can really afford it, and why there's so many quote-unquote problems with the ACA. Although some of those problems were already resolved, its future is still being determined within the Supreme Court. I will now be introducing my second artifact under business skills and knowledge. As you can see, I am discussing my medical assistant internship at Homefront Pumps, LLC. My work is primarily centered around working one-on-one with insurance companies such as TRICARE and Medicaid to provide coverage for expecting mothers who need breast pumps and breast milk storage bags. In the beginning, I was unsure about my internship and how it would help me find my passion, but at the end, it really allowed me to gear my focus on Medicaid and why so many people disapprove of it, when I view it as an added benefit and a step forward in providing insurance for everyone in the United States. This internship really allowed me to see the other side of insurance companies and medical facilities and what goes on behind the scenes. It also allowed me to find out why some facilities accept Medicaid and why some don't. It really just added to my passion of wanting to help fix the healthcare system even more, as I realized a lot of those improvements can be made within insurance companies. I will now be discussing a solution and how my passion for fixing the healthcare system can correlate with physician burnout, which is a topic I discussed within my Capstone 4400 course. My passion for fixing the healthcare system directly correlates to physician burnout within the U.S., as physicians are one of the pieces within a health system, and their problem with burnout is not only a state or local level problem, but a federal problem as well. Ever since the COVID-19 pandemic began, physicians have been struggling to manage their professional and personal lives due to the lack of supplies, problems in management, and further problems within our policy making at a federal level. The country handled the pandemic poorly, and the result led to a drastic increase in physician burnout as they lacked strong support from lawmakers. Since this topic directly connects to my growing passion of helping fix the healthcare system, I have proposed some solutions to help address physician burnout. With a culture of overwork, a lack of support resources within an organization, and a lack of autonomy, drastic effects such as access to care, patient safety, and care quality all follow when healthcare professionals start to feel the symptoms of burnout. I feel that we not only need to make changes locally, but also federally. We should use physician burnout as a wake-up call and begin making changes in the way organizations are run and start focusing our attention on providing adequate resources for physicians so they feel supported professionally and personally and are able to work well and provide quality care to patients. When physicians don't feel supported, the output of care quality is low, and thus patient satisfaction levels decrease. By providing that support, however, that physicians need, it not only helps them feel that they can work without feeling the restraints of burnout, but it also helps patients feel they are receiving top quality care, which is one of the main aspects of health systems management as a whole. Thank you for tuning into my presentation, and if you have any further questions, please feel free to reach out.